Wondering if you need reproductive hormone supplementation? We talked about how to tell in the last video, but how do you go ahead and support your ovaries and your testes? Well, in women, I like to begin, again, unless I'm using the estrogen as birth control, in which case you need to use the synthetics, the birth control pills, I will virtually always go with bioidentical estrogen and progesterone and testosterone. It makes no sense not to. The reason why the synthetics are used is because the bioidenticals are not patentable, which translates to they are not profitable for the drug companies. So the drug companies made synthetics that they could patent and taught all the doctors, well, any good doctor is just going to use this poison. They didn't say it quite that way, but that's what it translates to. Use the bioidenticals. Bottom line, the research shows they're much healthier. We don't see the increased cancer risk from the bioidenticals like you'll see with the synthetics. And here's how to begin. I like to begin with the creams. And a good compounding pharmacy can make it very low cost, a mix of what I call biased, two forms of bioidentical estrogen, along with the bioidentical progesterone. Um, some people like to use the skin cream. The skin cream works in the beginning, but after about a year, they often will not absorb it. And I find going with the vaginal cream works much, much more effectively for women. Then for men, I like to use, again, not the injections, not the synthetic bodybuilder toxic stuff. Stay away from those. Use the bioidentical testosterone cream. And again, use a cream. Make sure you put it someplace where you're not going to get it on your loved one. You do not want to increase both her libido because you may not be the one to benefit from it. It may be your fault. Put it where it won't get on her. And in women, high testosterone can trigger diabetes. Don't be tempted to do that. So, but put it on a place that won't get on them. And it should be adjusted to the dose that's optimal, keeping the blood test usually in the normal range. And people will often find that when that things will start going up and looking up, but some things will come down, like blood sugar, blood pressure, the spare tire around the abdomen, and a host of other problems. Your cholesterol will often come down as well. So, optimizing reproductive hormones, in my experience, is like adding 10 years to your life and leaving most people feeling and looking 10 to 15 years younger. I'm Dr. Jacob Teitelbaum, wishing you great health.